right. So, hey guys, I just wanted to make a quick update on how travel nursing has been going for me. I am officially 13 weeks in, and technically, actually, this week would be 14 weeks for me. But so far, I So far, I can say travel nursing is the best decision I ever made. Like, I don't regret it not one bit. Even though I am a brand new nurse, as you know, I only had 1 year experience um when I decided to do travel nursing, but I felt confident in my skills and my ability to work independently. And I'm not scared to ask for help because I feel like even nurses that have more experience than me, I felt like I still had opportunities where I was telling them or teaching them something that they didn't know how to do. So yeah, so far it's been 13 weeks have been done, and as you know, I also extended my contract for an additional 6 weeks. So I have 5 more weeks left into this contract before I'm done with this. And there are a few things that I've learned being at the hospital that I'm at. One thing that I've learned is definitely don't let people don't let people use you. And I'm not saying that I felt like I've been used. I'm saying that I have, in the hospital that I'm working at, there are LPNs, and I feel very sad for the fact that they are doing exactly the same job as an RN, except for, the small things that they can't do, like push meds. But other than that, they are still getting the same acuity of patients. They are still getting the same number of patients. And it's just crazy to me. I'm very grateful that I did RN and not LPN because I would be losing my mind if I was in that situation. But so far, as far as the actual travel nursing goes, I am getting paid well. I have paid off my credit cards. Right now, all I'm paying off, trying to pay off now is my timeshare. So once I pay off my timeshare, then um, I'll be, I'll have financial freedom. So that's like freaking awesome. I also have the hospital I'm working at has given me the ability to kind of pick my schedule for the most part. I know for the last 6 weeks, I definitely picked my schedule. So that was nice. I have not worked any holidays. I scheduled to not work any holidays, so that's amazing. Have not worked like that in like 5 years. For the last 5 years prior to nursing, every single holiday that came up, I was working it. So no Christmas, no Thanksgiving, no New Year's, no nada. So that's good. I've been given a few opportunities to like learn new things that I haven't that I wouldn't normally get the opportunity to do, because I feel like, as you know, I'm an ER nurse. So there's a lot of things that you do differently: ICU, ER, labor and delivery, med surge. Like, everyone has their little things, but there are things that are done on a med surge floor that you don't really get to learn, just because we don't keep patients. We're not supposed to keep patients that long. So I've gotten an opportunity to kind of get the med surge feel of it. I don't like it, but I've learned something, so I'm not mad about that. I What else? So I've had a few scenarios where Oh, I was training someone? Yeah. That just blows my mind. And it also, and like I said, I feel like that also speaks to my skills and the people that taught me. And the fact that they trust me, I've only had a year of experience, well, a year and a half now, and they trust me to train someone, which I'm grateful for. And it was a moment like that at my old hospital that made me realize that I could definitely go into travel nursing because they feel like I'm competent. So that says a lot. Um but I think the only thing that I hate right now about the whole travel nursing is that I'm in Maryland and it is cold as hell. Like it is winter and I hate winter. So I think for the next contract, um I really want to go somewhere that is warm. I say that and then I get a contract that's like X, Y, and Z, and then I run to that contract because it pays more. We'll see what I do next. But one of the things that I was scared about as far as travel nursing goes is that there has been, well, one thing I felt like maybe I would have gotten bad attitude from older nurses who had more experience from me and more experience than I do. And I know some people would feel weird, especially they know that I get paid more and I have less experience. So I was scared about attitude. And then I was also scared that I was going to be treated unfairly. Like, there's so many horror stories about travel nurses being put in situations where they have the worst patients compared to the staff nurses. And I understand that people get frustrated. We all start as staff nurses, so I get the frustration, but I was scared of that. But the hospital that I'm working at, I appreciate the fact that I don't feel like, for the most part, I don't feel like there's favoritism. There are sections in the hospital where there are low acuities, and some people do get placed in those positions often. But I don't feel like I've been stuck in one position all the time, or in a section in the hospital where the patients were high acuity all the time. I feel like I've gotten a variety of every part of the hospital. I think there's only one section in the hospital in the ER that I have not worked. And that's because they normally put the LPNs in that section, which completely makes sense. But other than that, I've been moved around all over. Up recently, they've actually been putting me in triage a lot, which I personally prefer to be in triage because you blink and the time's gone. Like literally, I started my shift yesterday, and by the time I checked my watch, it was 4 o'clock. And by the time I checked it again, the shift was over. So that's the only thing I appreciate about triage. The downside about triage is the fact that you are constantly moving. People are constantly yelling. People are constantly angry. And you're just having people talking at you. And it's just chaos out there all the time. And then the responsibility of making sure that the critical patients are actually being moved back, and we're not trying to ignore other patients and their problems, but you know there's a difference between life and death, so that's the only other thing about working in triage that's kind of scary. But I appreciate the fact that they trust me in order to put me in that position. um but so far I'm absolutely loving travel nursing. Like honestly, I feel like the more, and I love the fact that this hospital has really opened up my eyes about the fact that every hospital do things differently. um they do things so differently. And like, for example, TPA, like the hospital that I'm one of the hospitals that I've worked at, pharmacy always mixed TPA. And then another hospital that I was working at, we didn't even use TPA. They were using a whole different clot busting medicine, which I believe it was called tenecteplase or something like that. And at this hospital, they use TPA, but the difference is that the nurses mix it, and it's in vials like propofol, and you have the vial and you have saline, and you kind of mix it, and then you swirl it around, and then you pull up a bolus, you give the bolus, and then you do the infusion. So it's just so interesting to me how you go to different places and they're all doing different things. The way they give report for me is interesting. Also, I was at a hospital where they didn't even give we didn't give report unless it was ICU, and then we always brought the patients up. At this hospital, ICU come down for their patients, which I've never experienced that before. That was crazy. The only time I've had to bring a patient up is when I've had a patient that was intubated, and obviously we don't want to delay transfer, so I just brought them up immediately once they were stable. We just brought them up. But other than that, ICU comes down for their patients, and at this hospital, you always give report to all the nurses, so it doesn't even make a difference. Transport at this hospital is there 24 hours. The only time I've only had like maybe 3 shifts where there wasn't transport, and it was only part of the shift that there wasn't transport. But even then, the techs brought the patients up. What else? The manager at this hospital, I think he's the supervisor manager. He is amazing. And I honestly, when I was working at Carlisle, the nurse manager, absolutely love her. Absolutely love her. She's like one of the reasons why I would definitely want to go back and work at that hospital, because she listens and she cares. And then the supervisor at this hospital that I'm traveling at, he is so interactive with the patients, and it's not in a condescending way, because I've experienced where I've had a manager, she would go around and she would just ask, "Oh, so how's your care?" And it was pretty much more be like, the way she approached it, it was more of just to chart, just to put it into the computer system. Whereas the guy at the hospital I'm working at, he like genuinely cares about the patients. And the reason why I say that is because he's actually like, I've seen him more out there doing things for patients than actually in his office charting things, or I don't know, like I've seen him go get food for patients. I've seen him follow up, literally leave the waiting room. He would be in the waiting room for hours just trying to calm patients down, and going to providers to make sure that they're actually putting in orders, giving patients meds. I've seen him, he's always been able to put IVs in for patients. Like I've never heard him say no to a nurse who needed help. And that I appreciate so much, because that kind of attitude, it's that kind of attitude that make you not hate your job. Because when you're working with someone with a negative attitude, it honestly brings you down. And I feel like out of anything, and I've always said that out of anything, I feel like one of the reasons why people hate their jobs is the people they work with. It's not necessarily the patients. For me, I could have 6 patients, but if I have a genuine good teamwork, it's not horrible. Like, it's not as horrible because I know I'll get the help. And when he's there, I know that if I ask him for something, that without fail, he'll help. So I genuinely appreciate that. The attitudes in the hospital, not so much. Especially like, I feel like the attitudes from the traveling nurses are worse than the staff nurses, which cracks me up because you always think that the staff nurses are the ones that would be the more problem, but no. Like, those travelers, they're nasty. And I think the fact that they know they're leaving eventually, and the fact that they make more money, I feel like a lot of them have just this nasty personality, and it's just so gross to work with. So I can understand how sometimes the staff nurses don't like travelers because of travelers like them. And it just, mm, yeah, it, it's just, yeah, not for me. So I definitely don't want to extend this contract any more than I've already done. Um, I have made some genuine connections in this hospital. I can say there are at least 5 people that I'm genuinely gonna miss, and I'm genuinely going to miss at this hospital. And I hope that, eventually I bump into them again in the future. But yeah, I think I'm definitely ready to go somewhere else. I'm not really sure where, but I will definitely keep you guys updated on my next travel assignment. I'm excited to not only get a contract that's more than this, but I'm excited to just be in a new environment, and just to continue learning, because I genuinely feel like I'm learning more. And you have to be open to it. You can't just be closed off because you don't know everything. So I'm looking forward to my next contract, just because I know I'm going to learn more. So that's the update on my travel nursing assignment. Stay tuned for my uh next assignment, because I'm talking to my recruiter and I don't know where I'm gonna go. I'm applying to a few places, but leave a comment where you think I should probably go next on my assignment. I'm actually open to anything, really. I just want, I would love to get paid more than I'm getting now, but I'm more interested in going somewhere new. So I definitely don't want to be in Maryland for my next contract, which is crazy, but that's the plan. So don't forget to subscribe and leave a comment if you have anything to say. Um, and I'll definitely see you guys in the next video. Thank you so much for watching, and I hope you guys have a wonderful and blessed day. Bye.